I'm Dr. McCleary from Orlando Orthopaedic Center, one of the sports medicine physicians helping to take care of concussions. So I'm going to talk a little bit about what to do or to manage the symptoms of a concussion when a concussion has occurred. Really, it's very simple when it comes to concussion management. The nice thing is the brain injuries, especially concussions, do recover very well on their own with minimal intervention as far as direct treatment. What it involves though is a lot of avoidance of certain activities, particularly physical rest from sporting activities, but even from exercising such as running and lifting weights is very vital to minimizing symptoms. After it's established there's a concussion and no other conditions that can mimic a concussion, then other types of treatments can be done to treat symptoms. I mean, whether it's treating headaches with over-the-counter medications, and if it's treating sleep disturbances with other types of medications. But those things should all be outlined by the physician to give you very specifics about what to do in those situations. But there's other things that are also important for day-to-day activities. The biggest thing would be things like minimizing the use of certain electronic devices, whether it's on the phones, computers, video games. Those types of things tend to be pretty important. It's also kind of just really scaling back on a lot of your just day-to-day activities, especially this is true for the teenagers that have a pretty busy social calendar and trying to keep up with their friends and doing things. That can really put a physical drain on the brain and can slow the overall healing process. And then finally, as far as academic activities, I'm always encouraging the students to scale back some of their academic activities. We usually ask them to not take any big exams, maybe delay them if possible, maybe break up homework into smaller segments, maybe do 20 or 30 minutes at a time as opposed to working for a few hours at a time. Scaling back some of the school activity. We usually give them notes for the teachers to be aware of that as well. But the overall scope is just doing less is better. The less they're doing, the better they're going to usually start feeling. And typically when they're doing too much, it tends to drag the process on longer and kind of enhance some of their symptoms.